Hello, everyone. I'm Dr. Panda. I'm your doctor online. Today, I invite ophthalmologist Dr. Han from UCSF. Hi, Dr. Han.
Hi, how are you? Hi, everybody.
Yeah. So today, Dr. Han will introduce us how to apply for ophthalmology specialty and any kinds of interview questions or any like tips to share with us. Um, okay, so Dr. Han, what kind of candidate you're looking for?
So, as you all know, ophthalmology is every subspecialty is competitive.
Right.
Ophthalmology is one of them, and it's a combination of a clinical medicine and also surgery. So I think the few things we're looking for. Number one, you need to have a solid medical knowledge. So then you can practice clinical medicine. Number two, you have good hands, can be trained as a surgeon, be calm and professional to your patient in the OR and in the clinic. And number three, teamwork, like a team player.
Right.
So this to your peers and your supervisors, your staff, so people can get along with you. Number four, actually, we are looking for more and more its ability of research. So push the field forward, change the practice, helping people. So those are a few key stuffs. Besides that, you want to be warm, kind, hard, and that's all basic requirement.
Right. So I heard, okay, I'm not an ophthalmologist, but I heard you gotta be top 5% medical graduate to apply for ophthalmology. Is that true?
I mean, it's hard to say how do you like define the top five. And as you know, some of the medical school, there's no more grades anymore. It's a pass
Oh,
and a fail.
I
So
see.
right. So and then this is not like MCAT. You have a score. So a lot of time and more, there's no more score. So it's depending on performance, your recommendation letter, your personal statement, why you want to pursue this the subspecialty, and then number of papers you published, what your research path has been, what's your ability to solve a problem during the research activities. So now it's more a broader, not just score anymore.
I see. But I think a score is still kind of important, right? You still can sort of way to figure that out. The candidate is strong in academic, in a test or something like that.
I agree. I mean, test is objective and then can reflect your knowledge and easy to compare. But I think it's just a different school has a different policy.
I see.
That's current situation.
I see. So for those candidates, um, because they graduate from the medical school. I mean, these days it's kind of hard to get a research experience. So do you have any suggestion for those candidates?
Yeah, good question. I think number one, you want to know is what you're doing. What subject you're doing now may not relate to the subspecialty you're going to apply for. So, for example, you could do ophthalmology related research, but you end up applying for neural surgeon, for example. That's fine. I mean, I think what people are looking for it's the ability for you to conduct research and solve the problem and then prepare for manuscript. It's not like you have to do ophthalmology related project in order to apply for ophthalmology, because people change their mind over time. You may start with one project in one subspecialty, and then you gradually change your mind. I want to switch to another one. That's totally fine. People are all understand that. So number one, don't feel you're obligated has to choose ophthalmology related project.
I
If
see.
you can at the beginning realize at the year one, year two, you said, oh, I want to do ophthalmology, I want to do related research. That's perfect. That's great. But if you're not sure, you don't have to do ophthalmology related research, but just do something.
I see.
Yeah. And number two, after you decide, let's say you want to do ophthalmology, start earlier. So let's say so if you start early, like a year 1, year 2, you start work some research project, then you get the time to get your paper published. Nowadays, in the past, I think it used to be just you can be a co-author, but now people are more and more focused on the first authorship, or at least some co-first authorships. You don't have to be the first of co-first author, but like one of the co-first authors. So in order, so it takes a while, especially nowadays, there's many submissions. It takes time to get a paper published. There's a prepare, writing the manuscript, the revision, rejection, and finally acceptance. So that's why you want to start early. I mean, sometimes like a year 1, year 2, they're starting to looking for project. If you start late, let's say you're thinking about, I'm going to do something like do ophthalmology, and now it's year 3 or year 4, I'm going to choose some research project. It's very much you're going to end up taking 1 year off, like for doing research, which is nothing wrong with it, which is okay. So so depending on what your arrangement it is, if you do not want to take time off during the medical school year, so then just start earlier.
So so Dr. Han, so these days from those candidates you accept, so in your school, I mean, do they all come from really like a really good program, really good medical school, like a top 10 medical school? Or
if you believe the US news, so we're top 10 ophthalmology subspecialty training. I mean, just give you an example. For example, this year, we have 5 residents just matched like first week of February. And then 3 of them come from Yale Medical School, 1 from Harvard, and 1 from Stanford. Last year, and then a couple of MD, PhD. So I think every year we have at least 1 from Harvard. And then, I mean, you don't have to be the top medical school, but they are all very decent. Duke, that's all commonly encountered. Case, I think a track of the education is important, but your ability of other area also important too.
I see. Seems like a very competitive specialty. I see. And so my question is that if, for example, like those students, like they did not go to very privileged medical school, they ends up with so medical school, or not like a top 10 like a medical school, do they have a chance to get in?
Absolutely, they have a chance. So anything can happen as long as you make effort, and you set it as your goal, and if you pursue it, it will happen. If your medical school is not that strong, I think you really need to focus on research. So we have a resident, he had a few, not 1, not 2, I want to say 4 or 5 published manuscript as a first author before he come to our program. And then also you can spend some time with ophthalmologist, let's say 1 year research and working with ophthalmologist has like a research together that will promote you as well. So I mean, top school is great, but if you're not in the top school, you definitely has a chance.
So yeah, show your passion. So Dr. Han, I have a question. How many published articles they need to apply for ophthalmology?
I think to me, ideally, you can have at least 1 as if it has a first author. That would be the best. We have every year, actually, I want to say we have like resident has publications, first author in Nature Science, especially when they have MD, PhD, they have. So, and PNAS, that's like a very high-end journal. We have those kinds of resident, but you don't have to. But if you have 1 first author publication, that means you're able to do a research, solve a problem, finish the project. So that means a lot. Not necessarily if I have 1 paper I will be matched, that not that way, but it just make you very strong to compete with others.
I see. So So the tip is that better to have article with your name as the first author. So that make you look strong to apply for ophthalmology.
100%. Yeah, 100%.
And for those medical students, so your suggestion is that they need to start early, start from year 1, year 2. So that is very, very early actually.
Yeah. And then also depend on whom you know, whom you work with, because you need a letter of recommendation, right? And we all know how important it is. It's support you to apply for any kind of a level of like jobs, fellowship, residency, everything, because people are really good nowadays on CV, right? And then if you look at their letter recommendation, I mean, we're joking, right? Let's say if somebody say this is a good student, that means a bad student. And if truly this is a good student, they will say, oh, this is outstanding student. Like so it just terminology has a different meaning. And then also when we read the letter recommendation, it's depend on who write it. And if I know the person who write the letter recommendation very well, and I probably trust them more, and I know what's going on, and I'm willing to make a phone call to this person, and then normally actually we do give honest opinion. Sure, we sometimes, so let's, if somebody call me say, oh, so how's so and so to match ophthalmology resident into our program, I want to say nearly all time we honest. We may emphasize the good part, and but we will tell the true feeling of each person. So working with different people is important, and the letter recommendation is important.
I see. So Dr. Han, so how's the track of like ophthalmology residency program? So you get in, you got like a 4 years training.
So so the match is you match the same time you match for ophthalmology residency program, and also the same time you match for either transitional year,
Preliminary program.
year. Yeah. So that's the matching at the same time. I think ophthalmology this year's match slightly, it's in February, and I don't know what's the transition year or preliminary year. Probably just in next couple months will come out as well. So year 1 is your preliminary or transition year training, and then just PGY 1, right? So PGY 2 to 4 will be ophthalmology training.
I see.
In ophthalmology, you have 3-year total training.
I see. So yeah, during my residency training as an internal medicine resident, I actually work with some preliminary resident. So preliminary resident, they are usually has been accepted to really good, other specialty like radiology, ophthalmology, or dermatology. So the first year, they have exposure to general medicine field. So 1 + 3 for ophthalmology, 1 year in preliminary or the transitional year, plus 3 year in general ophthalmology year. And then after that, they will go to the subspecialty of ophthalmology.
Right.
So yes.
Yeah, so you have choices. So normally at year 3, except the plastic, they're matching at year 2, but now there's year 2 means ophthalmology year 2. It's a PGY3. So, but now even oculoplastic nowadays gradually switch to the last year match. So basically at year 3 ophthalmology resident, we're starting to match for fellowship. You don't have to. You can practice after 3-year training ophthalmology. You practice the general ophthalmologist. You can do cataract surgery, do surgery so you feel comfortable and see those patients. That's totally fine. We used to have half residents apply for fellowship, half apply stay as general comprehensive ophthalmologist. But nowadays, I want to say every year, everybody apply for fellowship training now.
Okay.
So fellowship training, including, let's say, retina, oculoplastic, 2 of them are for 2 years training. The rest are just 1 year fellowship training, including cornea, glaucoma, pediatric, oncology. Am I missing something here? Probably some like some specialty around this. Yeah, oncology.
how many years we're talking about for those fellowship?
So retina and oculoplastic are 2 years training, and the rest are all 1 year.
I see. Why these days like all apply for fellowship these days?
I think that people are probably just want to be more experienced, so then you can be more focused your subspecialty practice. Let's say glaucoma, just do glaucoma. Cataract, cornea, do cataract, cornea. Retina, just focus on retinal disease. Oculoplastic, do orbit disease, and cosmetic procedures, so on and so forth.
So it's just because, or maybe just because the market need, they requires like a fellowship training, like a pathology, specialty. They, I know that for pathology specialty these days, they requires you to have at least, 2 fellowship training after the, general pathology training. Is it the same thing for ophthalmology? The market, if you go through the fellowship training, it's easier for you to find a job, or is it?
I don't feel strong on that. Oh, I forgot uveitis, right? Uveitis is another fellowship. It's an intraocular inflammation. But in general, I don't feel strong. You have to you have to have a fellowship training in order to find a job. Even like it doesn't matter, like your academic, your large group of practice, your private practice. I think it's depend on the needs. There's definitely needs for comprehensive ophthalmologists that do comprehensive care and cataract surgery. There's definitely position for that across the whole board, academic medicine, like a large group of practice or private practice. And the subspecialty training just make you feel more comfortable, ready to do certain surgeries or seeing certain patients, or doing more certain like a research project. And maybe you feel more comfortable after certain training. I think from our program, it just people want to learn more. So I think that's why they want to do more training. I'm not sure this is just purely driven by the market.
Okay.
I guess retina oculoplastic tend to probably make more money afterwards.
Right.
So that's maybe they're also very competitive among compared to other specialty training among ophthalmologists. But I don't think that's the main reason.
I see. Oh, just because the people's like students like motivation, they want to learn more.
Yeah. They are interested in that field, and for lots of subspecialty practice, if you don't have that training, it's hard to practice. So I have glaucoma training, so I don't think I can do like a very specific certain retinal surgery or cornea surgery or strabismus surgery. I cannot do that. I don't feel comfortable. So you do need that step in order to practice in that way.
I see. So for the subspecialty fellowship training, so which is hot?
Right. So oculoplastic, retina are popular. Glaucoma actually in recent years are popular too, because we have lots of kind of surgeries. We call them minimally invasive glaucoma surgery. So that's also popular. Cornea, it's too. Pediatric uveitis is slightly less popular.
I see.
Pediatric probably is just in general probably. Yeah.
So how about the Lasik surgery? Which specialty can do this kind of Lasik surgery?
Yeah, so refractive surgery, including Lasik and other kinds, normally performed by cornea-trained subspecialty. Cornea-trained ophthalmologist. So cornea training, it's broad. You're going to do cornea transplant, for example, taking care of a cornea surface disease, and another one is refractive surgery. So normally, or actually, it can be performed by comprehensive ophthalmologist as well. Yeah, so either or anybody else, but I think the most common way is comprehensive or cornea specialty trained.
I see. So comprehensive ophthalmology. This is a general ophthalmology or the subspecialty?
They're just general. After 3 years ophthalmology residency training, you can practice as comprehensive.
Oh, I see. So you can do the Lasik surgery.
You can, as long as you feel comfortable. yeah, there's no like a certain board requirement in order for you to practice that. I mean, if I feel comfortable, I can practice too.
I see.
But you have to feel comfortable to do that.
Definitely. Just like for general internal medicine doctor, you can do colonoscopy, you can do many like procedures if you feel comfortable, So
Exactly.
yeah, depends on yourself, if you feel comfortable. So for the interview skills, like you probably like invite many candidates to your site, and during the interview session, which candidate you're looking for. I'm talking about you maybe share some information with us, just like person skills, kind of how do you spot out that's the right person.
Yeah, very good question. And then for just approximate number. So for example, I think pretty much every year is similar. So we have probably like over 400 applications for 5 spot, 400 to 500 like application for 5 spots. And then probably eventually they're going to screening for about 40 candidates, invite them for on-site interview.
I see.
This year, everything's a Zoom. So we had a Zoom interview for
Right.
the residency and the fellowship.
Yeah.
And then in the past, about 40 for residency applicants were invited to on-campus visit.
Right.
And then during the interview, I want to say you have to first you need to be confident. You present yourself and you confidence in yourself, and you make people feel it's natural to have a conversation, sitting to talking to each other, and then don't be too nervous. You need to be relaxed but be focused. And then you need to know your project very well. So very likely, so we spent, so to give you an example, we interview for fellowship, for glaucoma fellowship, for example. We also, about the, so we have only one position, but we pretty much about 50 applicants, and then we probably end up interview about 20, actually 15 to 20 on-site interview, and we pick up one. So good amount of time we're asking about your project. You did this, you published this, what's your contribution to this? How do you come up with this idea, and what did you do? Another question is, why do you want to do glaucoma, or why do you want to apply for ophthalmology? And then, so conversation is very, in most programs, especially West Coast, pretty relaxed, chill, and so just relax, be focused, confident, know your CV.
They observe you, see if you're the right candidate or not.
Yeah, it's a feeling. I have to say it's a feeling. We have been doing this for many years, and at my year one, I would say, oh my God, how am I going to choose up one from this 10 or 20 candidates, or 4 candidates from 4? How are you going to, like, at least 1 to 10 ratio? How do you pick up 1 from 10? But actually you have that feeling, and then when the committee meets afterwards, and then it's not off too much. I mean, of course, sometimes may rank one candidate into number 1, and another person rank them at number 5. But honestly, the top 3 or top 4, which is you're looking for, are quite consistent among all the committee members.
I see.
So I think it's a feeling, like maybe some people do like a mock interview. Maybe it's helpful, actually, especially for early stage, when you really haven't done any kind of interview. That probably will help you how to present yourself. And you have that strong feeling just by looking at the CV, talking to the person. You rank them in your mind.
I totally agree. That's the purpose of this YouTube clip. I want to teach those students the way how to present themselves, and what's the tip to become a good candidate. Highly selective, highly competitive program. They're looking for what type of candidate. Actually, there's something they can learn. They can prepare for those kind of interview. So, and you mentioned a very good very tips for them, actually.
Yeah, and this is a very important skill for you to master because this is not just for residency interview, same for fellowship, same for the job, same for your future career. When you talk to people, how can you provide that confident feeling? It's just something you need to master at early stage of your career. You're going to be benefited for the rest of your life.
Right, right. Definitely, I concur. That's is a very good skill set to master at the early age. You can learn. You can be trained for this. Like a two-person, one person is well trained, another is not well trained. So I think that makes some difference.
Mhm.
So,
Yeah.
and do you have any other kind of suggestion for future ophthalmologists?
I feel it just if you know what you want, that would be the best. Sometimes you don't know, which is quite common as well. And gradually you will during the medical school what kind of subspecialty you want to do. Uh, and if you made the decision, just keep working on it. And as long as you have the goal, I
Mhm.
want to say 99.99% chance you will achieve. So I think just be confident and work hard. Everything will pay off eventually.
Right. This is for any kind of job, any kind of career. You gotta have a goal, and then you have a passion for that, and walk for this, and eventually you will get your wish. So,
Yeah, totally. I mean, it's just, but this wish and this goal definitely need to from your heart. It's not
right,
like parents want me to do,
right,
like
right,
girlfriend want me to do, my
right.
boyfriend wants me to do. It's you want you to do. As long as you want you to do, I
Yeah.
think naturally you will do it.
Yes, I agree with that. During the Zoom meeting, Zoom interview, because I figure out that pandemic maybe will be here a little bit longer.
Mm.
Probably another 1 year or something. Because the mutation something. So I will see that the Zoom interview maybe will be needed for a little bit longer time. So during the Zoom interview, do you have any tips for those candidates? Because the the lines, the way to present themselves. Do you have any suggestion for those candidates?
I think it's that's good question. And then Zoom interview, you need to have a good connection. You don't want to be interrupted. You need to have some like some background, some lighting. It's a plus, but I don't think it's necessary. So, for example, this year we have one candidate. I mean, she has such fancy background and great
Uh,
because of her husband is a photographer.
oh,
Setup of things is just so pretty. It's just like
fancy.
very fancy, and I was like very impressed. I mean, you notice that right away. But I think that's just a plus. And the more important is conversation between you and the candidate. So I still think what candidates say during the interview, the conversation play a significant role, even for the Zoom meeting.
I see. So thank you.